Went into healthcare and to do the jobs we do because we enjoy doing exactly this, helping our patients reduce and, if possible, live without joint pain. So this is near and dear to all our hearts. And so as we get started here, almost everyone in the room knows someone, has or knows somebody with arthritis, I'm sure. And people with arthritic joint pain find that many of the activities that they enjoy become limited over time. And a few of the activities we see here and activities that my patients enjoy include golfing, going for a walk, spending time with their grandchildren. And all of these things become, in some cases, drastically limited with joint pain. So today, as we go through our little talk this evening, my hope is that it empowers you to make decisions about the future of your pain and hopefully the alleviation of it. I hope that the information gained also enables you to make the best decision possible. And if we can play a small part in that, this will have been worth it. So as an overview, there are three basic questions I want to address tonight. First of all, we'd like to talk about who gets arthritis, what causes arthritis, and also what we can do about it. We know from statistics that by age 85, over half of the United States population eventually gets knee arthritis. For those in our population that are overweight, this increases to 2/3. So this is a huge amount of our population that struggles with arthritic joint pain. There are differences between genders. Men and women develop arthritis at different rates. Under the age of 55, men more commonly will experience arthritic knee pain. And over the age of 55, women do. And so let's talk about some of the causes now. We don't know exactly why arthritis happens, but we do know there are several factors which do contribute, or combinations of these factors. One of these is old age. We know that as people age, they tend to get arthritic conditions. And so we know age is a factor, and probably the wear and tear that accompanies that. Obesity. We know that people that are overweight tend to overload their joints and seem to develop arthritis at a more rapid rate with the advent of more and more childhood obesity. This is becoming a greater and greater health issue in our country. Extreme sports, the advent of the X Games and motocross and skateboards and razor scooters and all of these things have increased the number of knee injuries and other injuries that affect joints. Any injury that affects a joint can damage the joint and eventually lead to arthritis. Also, we know that genetics play a role. I have many families that have come into my office, multi-generational families where the patriarch of the family has had a total hip or a total knee, and a couple of his children come in for a total hip or total knee. So we know that genetics and heredity do play a role. And we also know that muscle weakness plays a role. Now, why did I put this picture of a model runway? Well, the typical model walk is not a normal way to walk, and in fact, it kind of exemplifies what a weak hip how it would behave. And over time, hip weakness can contribute to bursitis around the hip and eventually can transfer forces down to the knee, and we believe participate in the creation of arthritis there. So what is arthritis? The word arthritis means joint inflammation. And it's come also to mean the degeneration that accompanies the pain we experience in our joints. And we know that the inflammation caused by the breakdown of our joints is what causes the pain we experience. And later in my talk, I'm going to talk a little bit more about some of the modalities that we have